And we are back on Open Line. We are glad that you're spending some of your evening with us here. We are talking to the endodontist. We're talking to Dr. Richard Horwat all about your mouth, whether it's a root canal, whether it's having a tooth pulled, whether it's your gums. A lot of questions, a lot of comments. So we are going to go right back to the line with us, with you right now. Christy, thanks for your patience. And do you have a question or a comment for Dr. Horwat?
I do. I actually have two questions.
Sure.
And my first one is there a pediatric orthodontic college or school that might help daughters?
I think you cut out just a little bit. You said that might help what?
Help with my 8-year-old granddaughter's orthodontic needs. She's going to end up needing braces. We're confident of that. And then my...
Oh, Christy, you're cutting in and out just a little bit. Go ahead, repeat that.
I'm sorry.
That's okay.
She currently needs a chin strap, which my daughter wore when she was young, and to correct it, that would be to correct her underbite, and the cloth strap and what's required to go with it.
You cut out just again. You said with the cloth strap and then.
Yeah, it would be the cloth strap as well as the orthodontist or the dentist that actually wants her to wear this this piece in the evening when she sleeps, and it is a cloth.
I can get most of it.
Okay.
Can you hear me?
You come in and out, but I think you got enough.
I think I have a little bit. I think I have enough to go on something here. First off, with regard to the orthodontics in the schools, you're going to want to check with a dental school. Just about every dental school has an orthodontic program in their school. I know that locally we have Meharry here, and I know that you also have a dental school. I think the closest one is in Memphis, unfortunately, which is a little bit of a hike. But you just want to check with your local dental school or dental schools, and then you're going to check into their orthodontic program. Regarding to the chin strap, you know, a dentist might think that your child needs that, or someone else may have had that, but dentistry and orthodontics and just about every field of dentistry, it doesn't stop evolving. Things like headgear and chin straps and things like that, where people needed them in the past, there's different techniques available now, and they may not even need to go that route. And even though one clinician feels that your child might need a particular type of appliance, the clinician that's actually going to the clinician that's actually going to render the treatment is pretty much going to make that call. I know that I've had patients as well come to my practice, and they would tell me what another dentist recommends, and that's not something that I recommend. Or I might do things a little bit differently. It's not an exact science, but so your child may or may not need the chin strap, but you want to check with dental schools. And then if you just go to the dental school and you can check into their orthodontic program there, I'm sure that they can accommodate you.
Okay, and I'm assuming that what you're somewhat suggesting.
Oops, you cut out again, Christy. You said suggesting, and then we lost you.
I'm sorry. I'm thinking that possibly what you could be suggesting is we might even get a second opinion on this chin strap thing.
I don't think you need us even. Well, it depends on what you mean by second opinion. If somebody is recommending you get a chin strap, if they feel that you need that, then that clinician should probably do the work if you're comfortable with them suggesting that. But you're telling me that someone's telling you that you might need a chin strap, and then but you also want to go to an orthodontic program as well. Whichever doctor is going to render the treatment, they're the ones that's going to make the recommendations of how they're going to proceed with treatment. So again, you know, you may or may not need that chin strap. You might go to the second one. You can always get an opinion by an orthodontist. I think most orthodontic consultations, I don't believe there's even a charge for that. So you can always ask them if they feel you need it. But again, just because one orthodontist will tell you need a chin strap, and if you go to a different orthodontist for the treatment, just because one orthodontist says that they need it doesn't mean that the second one's going to say that they need it as well. It's not an exact science, and people do things differently.
I do see. Thank you for your help.
Yes, ma'am. Good luck.
You bet, Christy. Thanks for calling in. We appreciate it. All right. So we are going back to the lines again, and Rhonda is on the line with us. Rhonda, again, thanks for your patience. And do you have a question or a comment this evening?
Yes. I went to the dentist to get a root canal and a crown. He started drilling. The tooth broke off. He couldn't save it. He gave me 2 options, and he started to tell me about the options. I asked him which is the cheapest, and he said a bridge. Well, the original root canal and crown was going to cost out of pocket, since I have a little bit of insurance, was only going to be like $800. Now I'm looking out of pocket $2,000. Is the bridge my best option?
The bridge is not your best option. Your best option, if you had a tooth removed, your better option is to get an implant. An implant is definitely going to be the best treatment available to replace a tooth. A bridge is another option. However, it is a less expensive option. It depends on the circumstances. I didn't like it. Okay, when you have a tooth missing now, if the tooth in front of it hasn't had any treatment or cavities and the tooth behind it hasn't had any treatment or cavities, I wouldn't even let my patient get a bridge even if they wanted it. Because when you get a bridge, you're essentially destroying 2 teeth to save 1 tooth.
We're destroying 2 teeth.
And bear in mind, 30% of all teeth that are part of a bridge abutment or the anchor to that bridge, 32% of those teeth are going to die over time. Because of the way they have to cut the tooth and prepare it for the bridge. So you may be looking at not only getting the bridge, but you might be looking at a root canal or 2 as well with that bridge.
The implant, is it going to cost more? Is that the option that I did not take? Is that he was going to tell me? You said it's going to cost more?
It's definitely more. If it's in your budget, it is without a doubt a better option. It's not even close, to be honest with you. You know, I can appreciate it if you have to get the bridge. There's nothing wrong with getting a bridge if you have to go that route. It's not, you're not going against the standard of care or anything like that, you know, and it was the pinnacle of treatments forever. It just so happens implant technology is really advanced, and right now replacing 1 tooth with an implant, you're going to pay a lot more money, but bear in mind that implant's going to outlive you as well. If you lost all the teeth in your mouth, that'll be the last one standing.
So I need to go back and have him to explain that option to me, see how much that costs then.
I really would consider going that route. If you do get a bridge, you can anticipate problems down the road. It might not be for 10 years or 15 years, but you can anticipate having more problems with that bridge, maybe getting the bridge redone, maybe getting root canals. There's nothing wrong with a bridge, and dentists do a really good job with bridges, but it's less expensive. The implant is definitely the better option, but you know it is more expensive, unfortunately. But insurances are now helping out with implants as well. When I was doing general dentistry and doing implants, insurances wouldn't touch them.
Oh, so, really?
Yes, ma'am. So just check with them. You know, it's not going to hurt to find out what your options are. You can make a much more educated decision if you know what all your options are.
I think I'll see just how much extra it will cost.
Yes,
I sure appreciate your help. Thank you.
Yes, ma'am.
Okay, thank you, Rhonda. We appreciate you. So, a lot of questions when it comes to that, and a lot of times, what causes insurance for a while not to pay for something, and then they decide that they are going to pay for something?
Oh, Lord have mercy. Politics.
Yeah,
right?
yeah.
You know, it's funny. When you have insurance and you're dealing with things like children and you're dealing with a child, you know, there's certain types of procedures where they'll call the child an adult as soon as they have all their adult teeth. It doesn't matter if they're 18 years old. If they have all their adult teeth at the age of 12, you know, it's amazing how insurances work. You know, when I was doing insurance, I used to know the inside and outs of, I used to know insurances inside and out. And every time I learned it, time went by, the next year would come and it would change. And I had to relearn it, and I had to relearn it. I've gotten to the point where I delegate that stuff out. If I'm not getting reimbursed for something, I might look into it a little bit. But you know, insurance as well. There's pros and cons to it. But things are time tested. Sometimes they know procedures don't work, and so there's different things involved. But the insurance companies are out there to make money. I hate to say it, but they are the middleman. They really help patients out in a lot of ways with money, if you don't have a lot of dental needs. But insurance is also going to pay for the least costly way to fix you. So they're not going to really, they're not looking to do you any favors per se.
Right.
Insurance companies are out there to make money. Don't underestimate what their intentions are.
And you know, we were talking a little bit earlier about when do you go for your teeth cleanings. You know, the recommended is every 6 months and that sort of thing. But actually, and of course, and that's what the insurance normally will pay, you know, twice a year teeth cleaning. But actually, if you really ask your dentist and they've been treating you for a while, they can probably say, well, this patient may only need to come every 12 months or this patient needs to come every 3 months. I mean, it can be,
That's true.
Can vary.
That's true. You know, I think that insurance is basically went through guesstimation where they went through the averages, and I think that they feel that the average person needs 2 a month, so they charge for 2 a month, and
2 a year.
2 a year. I'm sorry, and then and of course that's been universal. It's been the standard of care now. So now most patients think, hey, I need 2 cleanings a year. But it is different. If someone's doing a really good job taking care of their mouth, it probably is in their best interest to go ahead and get a cleaning twice a year, and to get their checkups twice a year. At least we can monitor things and see if anything's advancing, any type of pathologies are progressing. And if insurance are covering them twice a year, then you should go twice a year. That's really kind of the bottom line. But some people do need to have the patient that called earlier about the periodontal with the deep cleaning. You know, the tough part about that is that a lot of times those are covered twice a year, but oftentimes you don't get the result you want after 2 appointments, and they need to go 3 and 4 times a year, depending on the cleaning. But if you have really good home care, twice a year is definitely adequate.
Well, and let's talk too, when we talk about adequate care, and I mean, and that's what it's all about, is the way that you care for your mouth and your teeth and your gums and that sort of thing. So when it comes to proper care, flossing every day, and what's the proper way to floss?
Proper way, hard to tell you how to floss without showing you.
I won't make you do that on air.
I appreciate that. But you know, technically you should floss after every meal. You know, I know we joked around about this a handful of times. You know, I don't floss after every meal. I floss when I feel like I need to floss.
But would you recommend at least flossing every day?
I would recommend at least flossing every day. Preferably, if you're going to do it once a day, I would encourage you to do it before you go to bed at night. You should brush and floss at least twice a day. You should definitely brush twice a day. Make it a religion. You wake up, brush your teeth before you go to bed. Brush your teeth. If you're only going to do it once a day, definitely do it before you go to bed. Even if you brush your teeth before you go to bed, you're going to wake up with bad breath, and that's because your salivary flow kind of it slows down greatly. So the bacteria, they have time to procreate, and you wake up with bad breath. So I definitely would encourage you to do it before you go to bed, because you know, if you're going to do it once a day. But you should floss after every meal. After that, I guess you should do it twice a day if you're not going to do that. Bare minimum, you should do it at least every night before you go to bed. I would encourage you to do that. Okay,
and what about brushing? What's the proper way to brush? Because is it with a soft bristled toothbrush, medium? You see all of these choices in the aisles and Target.
I would only use a soft. I don't even know why they make the hard ones at all. Other than for cleaning supplies. I don't think that a heavy bristled toothbrush has any purpose being in your mouth. I would only use a soft one. Again, I'd have to show you how to brush without. It's hard to kind of describe it, but you definitely want to get the top of the teeth on the back. You want to get the top of the teeth on the upper back as well. I always have my kids, because I always show them, even though my kids, and they're 10 and 8 years old, I still go in there after they're done brushing and give them a drive-by. I'll go in there and I'll quickly brush after they brushed as well, because you can't really leave it up to a child 8 years and 10 years old. They really just don't understand how important it is. But I always show them, I'll go over the top, I'll go over the upper on the top of the teeth, I go on the inside rim, and I generally brush the teeth right where the tooth is meeting the gum. Because you kind of want to massage that gum area. Whatever debris is in the gums, you're going to want to get that debris out of the gums.
Circular motion, up and down.
I kind of go back and forth on the back teeth. I go, then I go on the outside of the teeth. I also go back and forth. I also will kind of smash the toothbrush in between my teeth and kind of wiggle it a little bit. When I go to the front teeth, I just kind of go up and down more so to kind of pull material out of there. I'm not overly aggressive. You don't really scrub these things or scrub your gums or anything like that. You know, if you're having any type of discharge or bleeding, that's usually a good sign. If it's bleeding, it's usually because you removed something. And if that's the case, it'll usually kind of subside or go away after 2 or 3 days if you're doing a good job. A lot of times your gums will even shrink a little bit if they're inflamed. But I generally do go the tops. I go and I think of it as brushing the gums just kind of barely. You're hitting the tooth, but you're barely hitting the gum.
Okay.
As well.
That's great advice. All right, we are going to take a break right now. We are asking the expert tonight here on OpenLine. It's all about your teeth. We're asking the endodontist, Dr. Richard Horwat. We'll take a break. We'll take more of your questions right after this.